Sadly, Ebola is and continues to be an important topic. Medical personnel is desperately needed in the crisis zones. But how can they help us protect themselves? We are now talking to Ms. Gutsche and Mr. Hirschfelder from DACH PPE about their protective equipment. Ms. Gutsche, what is the state of the art in protective clothing for highly infectious diseases today?
To protect from highly infectious diseases, we recommend using a chemically resistant protective equipment, which is equipment that is resistant to the penetration and by chemical fluids. Usually you would use type 3 or type 4 such equipment, type 4 being the equipment that is resistant against sprayed chemicals, and type 3 being the equipment that is resistant to big amounts of chemical fluids.
And what does the end user have to consider when using this protective clothing?
The end user has to be especially careful when taking the equipment off, because you should not get in touch with the contaminated surface, because then you risk infection yourself. And what we recommend is taking off the equipment by assistance of other people, so always as a group, so that nobody gets into contact with the contaminated surface.
Mr. Hirschfelder, you're also a manufacturer of protective clothing that is used in the treatment of Ebola patients. What is the special thing about this protective clothing?
Well, there was a major change in practice for this. Just this week announced by the WHO. They changed the recommended protective clothing from type 3B to type 4B. This has several advantages for the user. First of all, type 4 is much lighter to wear, and it's a breathable suit, so you can work for a longer time. And when you burn those overalls, if you burn a type 3, there's a lot of toxins, there's a lot of pollution going in the air, and if you burn a type 4B, there's less pollution involved when you burn them.
Thank you very much.